No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor, where we bring evidence based conversations on various chronic diseases and their reversal. In this episode, the third in the series on psoriasis, we deal with the complications and comorbidities associated with psoriasis. Here we have Dr. Jolly Thomson, who will be giving us a view on this subject with her over 35 years of experience in dealing with chronic diseases, including psoriasis. To begin with, most people think that psoriasis is a skin condition. What exactly is psoriasis?
See, psoriasis is basically an immune system disorder, basically. We should understand that. It's a manifestation of the immune system imbalance. There is an overactivity of the inflammatory part of the immune system. Actually, immune system has two wings or two parts or two sections, which we can say. So one is inflammation, that is the defense, protecting the body. Next is healing, that is repair of the body, repair at a cellular level, and rebuilding the body or the organ. That is the thing. So here the inflammation, almost all the lifestyle diseases are considered as inflammatory disorders. The inflammation is high. Why the inflammation is high? We know that infections, we know that there is a clear-cut reason for it. If the COVID comes, there is also inflammation is high. And we know that the virus is the creative. For all the infectious disease, we know this biological agents like virus, bacteria are creating the problem for inflammation. So in this type of autoimmune disease, what is happening is these toxins, it can be a part of the viral or bacterial infection also. Many of the autoimmune diseases occur after this. Even the psoriasis occurs, many of the cases. Not for everything, there will not be any evident pre-infective state. But it is very clear that the studies also show that the streptococcal infection of the tonsils or the skin, this sebaceous glands or something. After that, this flaring up of the skin psoriatic problem can occur. So basically understand that it is an autoimmune, your immune system is acting against your cells. There is a reason, and there will be most probably toxins, and it can be of any type of the toxins, and that we have to find out.
Actually, most of the psoriasis patients have other comorbidities. What are the major common comorbidities that are associated with psoriasis?
Common comorbidities means basically this progression of the disease can be the other autoimmune diseases like arthritis, uveitis, corneal ulcerations, or the liver problems. And other thing is, these problems can occur because of as a side effect of the medication, long-term medication. We know that steroids, if you are taking steroids, you can develop obesity and also diabetes. And if you are getting diabetes medication gets started, you can get all the other metabolic syndrome like hypertension, heart disease, atherosclerosis, cholesterol high. So any psoriatic patients who is on long-term medication, psoriatic patients will be definitely on some medications because they are suffering. They will look for medications definitely. And they will be having other diseases. If you look into that, definitely most of them will be obesity, at least overweight, excess fat will be there. When we look into the ultrasound scan, the fatty liver will be very good amount of patients will be having fatty liver, maybe 70, 90, 80, 90% will be having fatty liver. And if you look into the liver function test or the kidney function test, there can be also kidney problems will be there. If you are looking to the blood test, there will be most of them will be pre-diabetic. Even the HbA1c, sugar may not be high, but their HbA1c or at least the insulin level will be high. And I have seen the patients, their HbA1c and the sugar is high, okay, but the insulin level will be high. That means it is a type 2 diabetes, pre-diabetic stage, and insulin resistance is already started. And cholesterol will be, or at least the triglycerides will be high. So many problems, almost all the disease can accompany with, especially those who are suffering for many years. They'll be having not only the psoriasis, all these other common diseases like diabetes, hypertension, heart disease, all will be associated with it.
Actually, you were telling that many comorbidities are usually associated in psoriatic patients. Now, those psoriatic patients will then definitely be having to take many medications to deal with their different issues. So how can a patient, a psoriatic patient, do has to deal with these sort of multiple medications? How can he, I mean, what should he understand about this sort of multiple medication treatment?
See, psoriasis, this medication itself can create it's a trigger for the psoriasis actually. There are many medicines, many of the antihypertensive medicines and anti-malarial medicines, and there is a long list of medications which can give drug-induced psoriasis also. So if you are taking a medicine and if you are getting a psoriatic sort of lesion while you are on a medication, then definitely take it as a sign of that it can be because of the medication itself. Because when you have a disease, your immune system is under stress. All these diseases we are categorizing in the lifestyle diseases, like this diabetes, hypertension, this metabolic syndrome group, and also allergies, asthma, and also this cancer. All these diseases, when the disease is there, your immune system is under stress. Inflammation is high. And all the psoriatic patients, either these inflammatory markers like CRP, HSCRP, ESR, etc., will be at least some of it. It depends on the patient. Some patients show some of these inflammatory markers high. So that means inflammation is there. That is the primary, the body's immune system is producing excess inflammation. That defense part of the body is overactive. And you have to balance the immune system, this healing and inflammation and anti-inflammation. The defense and healing has to be balanced. Then only you can come out of this disease. And also, if you are basically almost all the medication for the psoriasis is immunosuppressants. So just suppressing the immune system will not give you, it is not the correct way. The immune system is overactive because there is a toxin. If it is, it can be in the form of a biological agent like a bacteria, virus, or some other chemicals, which is not suitable for you. So one chemical which may be okay for one person may not be suitable for you. So you have to find out and distinguish that and avoid that. And also you should give enough nutrients. Your body is basically made of nutrients, food. So you should be given, the body has to be given for the repair, for the tissue. If the repair activity has to take place in the proper way, you need almost 57 nutrients. The one is oxygen and the next is water, most important. Then other 55 items are there. 14 vitamins, 14 minerals, and around 20 amino acids and 4 fatty acids, especially the omega-3 fat and omega-6 fat. Actually, they are the controllers. The immune system is controlled by omega-3 fat and omega-6 fat. Omega-6 fat is controlling the inflammatory part, and the omega-3 is controlling the anti-inflammatory part. In our modern diet, the problem is the omega-6 is so high, very high, and omega-3 is very low, and it's almost many of this is very trace only. So actually this high omega-6 inflammatory fat and low omega-3 anti-inflammatory fat is actually giving an imbalance to the immune system and triggering all these diseases, not only the psoriasis, other diseases also.
Actually, you were mentioning about stress. So what is the role of stress and sleep in psoriatic patients?
See, stress can give a flare-up, and stress will give sleep problem also. When your flare-up is there, you will be having, psoriatic patients will be having itching and so much trouble. They will not be, because of the itching, they will not be able to sleep. I remember one patient, she is telling me, "Doctor, I have not slept for many days because I am not able to sleep because of the itching." So will be in such patients, severe itching, it is very common, but it is some patients the itching will be very severe. So most of the patients, psoriatic patients with a severe disease, they will be having this sleep will be affected, and they will be, because of the stress itself. The stress can bring the disease, and also the disease can increase the stress and the sleepless night, and it will again flare up. So that is the situation. But if you have correct approach is there, within a day, I remember that that lady, she wanted to, usually we investigate the first day, and then next day only we maximum. If the earliest means the next day. Because of her difficult situation, we started her treatment in the first visit itself, because she was in that much trouble. And next day, again, in such cases, we ask for them to come on the next day also. So for that, only the partially we'll start, and then next day also. That lady came the next day, and did you sleep? Had a good sleep? She said that for many days I slept. That is comfortably. So that is the result actually. If you give your body the correct nutrition and the skin the correct support, and definitely the sleep medication, actually I don't give this induces actually, that sleep rhythm correction, like that is also natural. The melatonin, that is actually the sleep, the one hormone is there for the sleep. And along with that, the lifestyle correction also. Lifestyle in the sleep habit also has to be developed. And if you're looking on the computer and going sleep at the 2 o'clock, and such things also create a problem. If you are in a trouble, you should go according to nature's rhythm also. The sleeping in the night and no light, that is actually the melatonin will come out only if you put off the light. If you are sitting in the middle of the night, bulbs and all, or looking in the computer screen or the TV screen, you will not get the sleep, and the melatonin will not come. You have to adjust the natural rhythms, or you had to adjust with that also. You should understand it, correct it, and then it is easy to come out of these problems.
What is it that you can say, because some psoriatic patients, they find it difficult emotionally and mentally also to manage psoriasis. So what is it that, what is it that can help them to overcome their mental stress?
Yes. See, first is to any disease, if you want to overcome, first you should understand the disease itself. And then you have to say, psoriasis, the disease is an autoimmune disease. It is your immune system is under stress. And why your immune system is under stress? Because there is excess toxin in your body. The excess, which is the toxin actually, what toxins? We should understand that in the air pollution is there, our food is totally polluted, and so much of pesticide residue is there, so much of this water. So in many things you may not be having much control over it. That air, you don't have much control, but you can avoid this perfumes and the stress itself. You can take care this as much as possible. You use natural cotton dress, preferably white dress, because the chemicals will be less on that, and wash it with many rinsing of the, if you will be using detergents, and see that at least 2 or 3 or 4 times. If you are sick, if you are suffering from like psoriasis, you should rinse it at least 4 times, and so that all the detergent residues will be gone. And such things to reduce the toxin, and also this color and preservatives in the food. You use the fresh food only, and also we are taking so in the modern world. You will be eating. I am sitting in Cochin, Kerala, and not the southern part of the India, but I am getting all the foods from the New Zealand or the China or America or the Europe. So, and it is in the fresh fruit form or in the dry fruit form, on so many things which is made in the different part of the world, and we don't know the ingredients, we don't know what is actually applied on the things. Even it is looking fresh, it will be looking fresh, but it will not be fresh, and many things may be applied on it, and it is all you are taking it in that form. So human is supposed to live with the food which is made around in maybe within 10 or 20 kilometers. But we are getting it from all over the world, and it is preserved, so much of preservatives. There are more than 10,000 this generally approved chemicals which can be added into the food. So that is it doesn't mean that it is approved preservative. It doesn't mean it is safe for you. And imagine what all things actually we are eating, and you have to understand that first. What is the reason for disease, and what is your body is made of just food alone, and what are the food you are ingesting, and what is harming you. If you get an understanding that, and if you are willing for the correction, and if you get proper support, because everyone, the profession, the expertise is needed. Expertise means modern medicine or any medicine, that you should understand that also. The modern medicine or the latest medicines you are looking at, you will only get the medicines list. You will not get the understanding about the lifestyle correction, which can be give a relief for you. So you should look for that specifically and try to get support for that.
Actually, when patients who are on immunosuppressants or biologics or other having serious other complications and comorbidities, when they come for treatment for psoriasis, uh, when you're looking at it from a lifestyle correction perspective, how can we, what is it that they can expect?
Basically, in my approach, that is clinically supported lifestyle correction with cell activation protocol. This is based on a protocol which is made with a very long exposure to such diseases and treating such diseases. And not only the psoriasis, it is made for any lifestyle disease actually. The psoriatic patients also will be having diabetes, hypertension, heart disease, and arthritis, and different problems will be there. And actually, this is a single solution for all these diseases actually. So what is actually, you're doing the lifestyle correction with the protocol. So that is why I am able to manage different diseases at a time, and also different type of people. One person may be having for a heart problem, they ask for a bypass surgery. The other person, the same day we are starting treatment for one for the psoriasis, or one for psoriasis plus arthritis, and one person may be having some other disease like this osteoarthritis with obesity and osteoarthritis, advised for a knee replacement surgery or something like that. So whatever is the disease, we will be focusing on the body of the patient, and we will be doing detailed investigations and to find out what are the problems, what all systems are affected. It's only the psoriasis, it's only the skin is affected, or there is affection of the joint is there, or there is associated comorbidities like diabetes, hypertension. The patient may not be aware of it. Many of the patients, they are only after when we are looking into the detailed blood test and all, they'll be aware of the liver problem or the kidney problem or the starting of the, not really starting, they may be having a severe diabetes also, the HbA1c may be 10, or I had seen patients like that because they are taking steroids and they are unaware of the diabetes. It's already in a severe form actually. So all this first thing is that finding out the problems and studying the body. Then even we will go learn to a detailed test about what our food is reacting to them, and then avoiding such things and give optimal nutrition, that is special food with the high omega-3. Omega-3 is the healing, so you need a high omega-3 food, but omega-3 you cannot just omega-3 alone will not be sufficient. Along with that omega-3, the omega-3 fat is a very fragile fat actually. You cannot take a lot of omega-3 high seeds, high omega-3 seeds like flaxseed or other, some seeds are there, very super seeds. So if you take that, that is also harmful. So along with that, you should ensure that all the other antioxidants and vitamins like zinc, selenium, and B-complex vitamin, and all that, it's not only one, it's all the associated nutrients also should be there. Then only it can balance the immune system and help you in the repair activities. Repair means the repair of the body, the skin has to be repaired, the damaged skin has to be replaced by the new cells. For that you need the nutrient, the building material should be there. That should be also in pure food, not with the additives like preservatives, coloring agents, tastemakers. So that you cannot take the tastemakers also. So that is the challenge. Without any of these items, you should get the optimal nutrition and also activities. The psoriatic patient with the arthritis and all will be finding it difficult with movements. So the gentle movements which can activate them, and that is just in a protocol. Actually, it is in a systematic way we'll be following the patient, and also in the initial stage, every week we will be checking what is the inflammatory status, whether the CRP and ESR or the blood count, if it is high, whether it is coming down. Or I had seen patients with a very low blood count because of the methotrexate they are taking, and the methotrexate they are whether after if blood count is low, we'll try to reduce those medications faster. And whether the count is increasing also, blood count, it's in very low blood count, WBC count is very low. So when you are reducing the medicines like methotrexate and giving proper nutrition, the blood count also will come up. That is so. It should be more in the modern medicine. It is not only medicine; it should be evidence-based. If the lifestyle changes also, we cannot just say that it is giving effect. It is only not only the symptomatic relief you are following. It is the each anti-inflammatory markers, and also we'll usually see AMA positive or anti-TPO positive also, even though they may not be having thyroid problems. So that also we have to consider, and we'll be following all this with the evidence-based medicine actually.
Actually, when these patients who are having other serious ailments come, then won't they be expecting that they should be treated as inpatients and they have to stay in the hospital or something like that? You always say that most of them actually should not be staying in the hospital for their lifestyle correction. How do patients understand that?
Yes, basically, for this lifestyle correction, if you are admitting and doing, when they are out from the hospital, the problems will come back because they are in a different, their food will be different and the lifestyle pattern will be different. If it is in Kerala, I always encourage them to come to once in a week visit will be initially 3 visits should be in a weekly interval, or 3 visits will be sufficient weekly, and then every month, then bi-weekly, that after 2 weeks, and then a monthly visit will be enough. No admission is not needed because we won't. The psoriatic patient or even the heart patients who are advised for a bypass surgery also we are taking, and none of this is an IP patient. It is they are living in their own home. That is always better. But if patients from overseas patient and all, we are asking them to stay at Cochin for 3 to 4 weeks. That will be usually enough because depending on their problem, if they can stay more than definitely it is 90 days stay. It is all good, but usually 30 days to 4 weeks stay will be sufficient for most of the diseases. And many of them will be working at the present condition. Even if they are not working, they may not be able to stay away from home because there will be so many responsibilities. And you're teaching the patients to stay at home and doing the things, and we are following it up over the with the digital follow-up. Now the technology is very efficient now. So even the food support, we give food support also, and nutritional support actually. So it can also be courier. It's all flight couriers are available, and they can get it within 2-3 days, and so that way it can easily manage. Only thing, if an overseas patient or from the US or the UK, I am treating this overseas patient also. So they had to come down to Cochin for at least, if they are overseas, it is always better 3 to 4 weeks, depending on their severity of the disease, they had to be there. Or if for that actually, distant patients, we ask for a telemedicine consultation, and they can send out their reports, or we can talk over depending on their problems, and see their reports, and then we can tell you. I can tell you what is the you can expect also. What is the situation depending on the situation? What is the expectation you can, and so if they're staying, they're coming in Malayalis, that is my Keralite people, who are coming from the US and the UK and or for the treatment, they will be having so many engagements, and every day they'll be having that sort of things is not possible. Or then you think that then you can see for the sightseeing, some sort of sightseeing, and or the other nationals, they can some sort of this thing. But if you are fully concentrating on this as a tourist, to see visiting the places, it may not be possible. But you should concentrate on the treatment itself and have some other entertainment also. That way, it will be very effectively. You can come out of almost all that, because I'm around Indians and the Malayalis are all over the world, and they are also coming for the treatment. I know, because of that, I know what all the treatments are available and what is the treatment situation in different, almost all the major countries, and they are able to come most of. If you are staying on a month, or it depends on the situation, they can come out of almost all the medications. They may be taking medication for the diabetes and hypertension along with the psoriasis problem or the arthritis problem for many years, and they can come out of and make sure that with the reports itself, see that the this psoriasis, symptoms itself, the flakes and the itching is gone, and the appearance show that. And internally, you can see the inflammatory markers and other metabolic disorders are there, hypertension, diabetes, everything you can check and see, and it is evidence-based. Evidence should be there. And the patient, because we are doing this test every week to give the confidence to the patient also. And I also have this, if the patient is doing like this will be the result. And if the result is not there, what is the problem? We are finding out also that there may be something patient is not able to understand. That is maybe creating the problem.
Finally, if we want every psoriatic patient to know something that he can start off today, that is some habits starting from today that will start to help in his treatment and overcoming his problem. What are those things that you would suggest?
Basically, one thing the patient has to do is to do at least half an hour to 1 hour light exercise at least. And correct your sleeping pattern. And do exercise, correct the sleeping pattern, and avoid this food with the color and preservatives, and adjust to minimum number of food. You eat the food, but not from all sort of things, and minimize the ingredients in the food. Then only you will be able to find out which is comfortable for you and which is reactive for you. If self-modulation or self-lifestyle correction, that should be the only way out. But the support, and also see that you are taking a balanced diet and high omega-3 and all the nutrients is there. So I can't say a simple solution for that. That is why I'm giving actually nutrition food also, supportive food also we are giving to make sure that the person is getting all the nutrient in the correct proportion. And also the exercise also, what we are teaching them is to activate all the muscles. There are around 650 muscles in our body, and all the 650 muscles, and also then the final part in the meditative, that relaxing your brain and activating your brain and different parts of the body. That is done in a systematic way, actually. So that has to be learned. That is why I can't treat in digitally or remotely. I won't be able to teach these things. The ideal things, if you had to be taught exactly, then you had to go through this process of this protocol and learn it and then practice it. And then it is possible to support you remotely. That is possible. But teaching is from the beginning, it is not possible, cannot be done remotely. And the simple way, you leave this correcting this stress reducing and all, as I said, you can practice at home.
It is a very big relief to know that simple things like getting good sleep or eating simpler foods, avoiding foods with colors and preservatives, and trying to find out ways in which life becomes simpler can actually help. Most probably even reduce stress in their lives by keeping to simpler routines. So anyone can actually try it out and see if differences are coming up in their lives, and especially with respect to their psoriatic issues. Thank you. And this brings us to the end of this third episode. In the first episode, we looked at the reasons, causes, and the underlying factors of psoriasis. In the second one, we went into the latest current treatment options. In the third one, the current one that we have just finished, we saw the complications and comorbidities associated, and also the possibility of lifestyle correction in making a big difference. In the next and final part of this 4-part series, we will be looking at how clinically supported lifestyle correction has made changes to the very lives of psoriatic patients, also those who have been suffering with associated comorbidities and complications. Thank you, and join us again with the lifestyle disease doctor on our next episode.